UH's Seidman Cancer Center could change the way that doctors treat and cure breast cancer. Welcome, Dr. Lyndsay Harris, the director of the Breast Cancer Center. Thanks for being here.
Thank you. It's a pleasure.
So there are advances in both the cancer itself and treatments for it.
Exactly. So we've come a long way in our understanding of breast cancer. We now know that it's not just one disease. It's actually made up of several different kinds. And knowing that actually helps us choose treatments for patients more effectively. It's more targeted against the kind of cancer that it is.
And I wasn't even thinking that it's made up of several different ones.
Exactly. I think of it as like a bowl of fruit. They're all fruit, but you have, apples, oranges, pears, bananas. They all have different features, and it turns out that the different features of the breast cancer tell us, what's wrong with it and how to target it, how to develop therapies against it.
So, and there are some great new developments out there.
Absolutely. So we've now been able to cure many women who we weren't able to cure before because of these understandings of what are the molecular targets or the molecular underpinnings of the tumor. We also are coming into the genetic era. You've probably heard about sequencing the genome, and it's all over the news.
Yes. Remember back from my school days, too.
Exactly. So we know that every cell has DNA, and the DNA has a genetic code in it. Well, it turns out that cancers are just cells from your body, and they also have a genetic code, but that genetic code becomes abnormal. And so we can go in now and read the genetic code on the cancer cell and actually use that fingerprint to design, almost like a lock and key, a therapy against that particular abnormality.
Now, when you say that you're able to cure people that you might not have been able to before, is it always only early stages of breast cancer, or has it gone on to it being able to cure some advanced stages as well?
Well, that's a really great question because, of course, we've been extremely challenged by, trying to cure advanced breast cancer. Certainly, cure of early-stage breast cancer is where we've made the biggest strides. But we've also improved our cure rates, our survival rates for breast cancer by many years in the advanced setting. So, nowadays the average survival is measured in years as opposed to months. And that continues to improve, monthly, yearly we have new therapies that are really making a huge difference.
And I think sometimes people, when you're talking about research, they don't think about how much possibly goes into research. I mean, if you're talking about one particular study, how long are people researching to finally come to some kind of hypothesis or conclusion on it?
Right. Well, and these things take many, many years, unfortunately. The process tends to be quite slow. There's a lot of frustration about that. We'd like it to be faster, but on the opposite side, you have to remember we have to be very, very careful because we're talking about people's lives. We're talking about new therapies that may or may not work. They have to be adequately tested to make sure that they really are better than what we have already. And so these things take time, and so it can be several years between when a concept, a new thought, a new discovery is made, and when an actual therapy against that is developed and used to cure patients.
And that I know there's frustration because people just want to cure, but I'm sure in your eyes, someday there's going to be one.
Absolutely, and I hearken back to the idea of heterogeneity or different types. So it's not going to be one cure for all cancers. It's going to be a different type of treatment and cure for each individual patient. And sure, there may be commonalities. There may be 10% of patients have this, but it's not going to be 100% of cancer patients have the same thing.
Sure.
So it does take some time and energy to make that all happen.
Well, thank you so much, Doctor, for being here. I appreciate it. It was so nice to meet you.
Great to meet you.
A lot of good information, I think, to let people know about.